Oh, hi, didn't see you there. My name's Belinda and I have a question for you. Would you happen to be experiencing any of these symptoms? Abdominal pain? Diarrhea? Tiredness or fatigue? Or nausea? If you are experiencing any of these symptoms, you may have Crohn's disease. So what is Crohn's disease, you ask? Crohn's disease is a condition in which the gastrointestinal tract experiences inflammation. This may lead to ulcerations affecting the way the body's digestive system functions. So who does Crohn's disease affect? Approximately 75,000 Australians are living with Crohn's disease or ulcerative colitis, or 1 in every 250 from age 5 to 40. This number is projected to rise by 2022, meaning more people lining up to the doctor's office. Males are slightly more likely to contract the disease, and it is most commonly diagnosed between the ages of 15 and 30. So, now you know how it is caused and who it affects. How is it diagnosed? When diagnosing CD, it is important to rule out any other gastrointestinal diseases. Patients suffering from diarrhea should be tested for infection, IBD, and in certain cases celiac disease before a CD diagnostics is made. Conditions that present similar to CD include appendicitis and Behçet's disease. As the presenting symptoms of CD can be insidious and non-specific, diagnostics can be hard. Therefore, the presence of symptoms is aided with radiologic and endoscopic findings to perform a diagnosis. In cases of colonic or ileal Crohn's disease, endoscopic findings are classically characterized by skip lesions, a wound or inflammation that is clearly patchy, skipping areas that thereby are unharmed, with varying degrees of inflammation next to areas of normal appearing mucosa. This is different to ulcerative colitis that has continuous colonic involvement, beginning in the rectum. Common pathological findings include varying degrees of infiltrate from lymphocyte plasma cells and granulocytes, basal lymphoplasmacytosis, distortion of the crypt architecture with shortening and disarray of the crypts, crypt atrophy, crypt abscesses, and crypt branching. Imaging can also be used to diagnose Crohn's disease. Both computed tomography enterography and magnetic resonance enterography allow for the visualization of the bowel wall, showing mucosal and extraluminal complications. Image A shows Blackman, a spreading diffuse inflammatory process with the formation of pus caused by Crohn's disease, while Image B shows hyper-enhancing mural thickening associated with Crohn's disease. So how does one treat this?
Most patients with CD will undergo surgery throughout the course of their disease.
Surgery is used in a number of situations, including structuring Crohn's disease with obstructive symptoms or issues related to the drainage of the fistula, failure of medical therapy, steroid dependency, dysplasia, or cancer. The exact surgical procedure depends on the underlying indication for the surgery.
Due to the varied differences that come with Crohn's disease, treatment is highly individualized. However, the main medical treatments currently are antibiotics, immunosuppressants, and anti-TNF biological therapy.
Our drug uses the principles of other 5-aminosalicylate drugs. This oral pill helps to induce Crohn's disease and help to reach normal body maintenance. If you have Crohn's disease, why not try it? Call 123-456-789 today for your free doctor consultation and possible free trial.